Getting Juvederm Plus. Is it okay when you have regular Juvederm in your cheeks? I have almost 6 syringes of Juvederm in my face for acne scarring, and it worked great. But I want to get a tiny bit more just to touch up a few small spots. Is it okay to switch to the longer lasting Juvederm Plus for the touch up, or should I stick with the same? Thanks.
Thank you for your question. You submitted a question without a photo, and you're asking that, and you're stating in your question that you've had about 6 syringes of Juvederm placed for acne scars, and that you're going to go back and for a touch-up, and you're offered, I believe, Juvederm Plus or Juvederm Ultra Plus. And you're asking, is it okay to have 2 different types of fillers, or is it better to stick with the one that you started with? Well, I could certainly give you some guidance with this question, even in the absence of a photo. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I use a lot of fillers in my practice, and we treat a lot of acne scarring. In fact, the applications of this whole spectrum of fillers includes not only fillers in the Juvederm family, but also in the Restylane family. We also treat acne scars with platelet-rich plasma, platelet-rich fibrin matrix, regenerative medical technology, as well as fat grafting. So certainly I am very familiar with this question. To begin with, it's very good to hear that you're satisfied with the result. You know, the challenge with acne scarring is, of course, first diagnosing the type of scars and using the right strategy to maximize the outcome. Now, chances are that with having undergone 6 syringes of Juvederm prior, that you were getting a lot of injections intradermally, like within the scar, and probably some subdermally under the skin. And the difference between the 2 products has to do with relative thickness and viscosity. There's basically a direct correlation. The thicker the product, the longer it lasts. However, the thicker the product, the better it is to place deeper. The reason is very straightforward. When you are more superficial, let's say putting aside acne scars, but let's use an example like lips or finer lines or wrinkles. If you use a thicker product, it just doesn't fit very well, and it can create like an elevation that's undesirable. When you place the material deeper, it can really work out very well. We actually do a procedure called structural volumizing, where we routinely use Juvederm Ultra Plus to augment and enhance the cheekbone, the jawline, the chin. Place it deep at the bone level, under the muscles, and it lasts a long time, and it provides correction for a longer period. So I think that the reason your doctor probably is considering Juvederm Ultra Plus may be based on an assessment of the response of certain areas of the acne scarring which didn't hold up as well with the Juvederm Ultra. So, which means that the natural thinking for a physician is, if something less thick didn't provide a correction, maybe something more thick will. It's that straightforward. The coexistence of the products is no problem at all. The products are all in the family of hyaluronic acid, and as I mentioned earlier, it is routine for us for acne scarring to combine hyaluronic acid with platelet-rich plasma. This is something that every doctor approaches acne scarring, particularly, every doctor approaches from the lens of their experience and their experience using certain products and strategies. So there's never a right or wrong, but there often is a general concept as to how to manage particular types of issues. So I think it's perfectly fine. I think you should, to get a more clarification, speak to your doctor about why the choice was made to go to Juvederm Ultra Plus. I would suspect it's not about longevity, but rather about its ability to maintain its shape in certain areas where it might be of greater benefit. So I hope that was helpful. I wish you the best of luck. Thank you for your question.